We now have 3 sessions, one-on-one conversations with 3 different companies that are helping change the medical world. And I would like to invite the moderator, Maayan Hoffman, the head of strategy at the Jerusalem Post, to lead these 3 conversations. The first one will be with Yaky Yanay, CEO of Pluristem. Thank you.
With the initiative, we want to, I told you, to organize medical council.
Well, it's such an honor to have you here. You know, I've known Yaky now for several years in the company Pluristem, and I will say that when I do stories and interviews about you, and I say placenta cells, my colleagues say, "What are you talking about?"
Okay for you.
So I want us to get started by just learning a little bit about Pluristem. What is the company? What are you doing? Give us that elevator speech.
Thank you, Maayan. So first of all, I must start and say that I feel very privileged to be here in this location. So we hope to see many more of that coming. So Pluristem, imagine that you could hold in your hand a tiny robot that you could inject to anyone in this room. And this robot will communicate with the body. It will be able to understand the signals of the body and to respond and secrete many drugs, many cytokines, to create regeneration. This is basically what we are doing in Pluristem, but in a much more sophisticated way. We are using cells. Cells are small creatures that we are harnessing from placenta, and we have developed in the last 15 years the method to expand them very efficiently and to introduce for many severe disorders. So this is the business that we are utilizing. We are holding, in my opinion, the next generation drugs that all of us are going to use in the very near future, because cells are very powerful creatures, and we are using them in order to create health and wealth.
Amazing. And actually, just last month, Pluristem had a pretty big achievement. The company reported positive preliminary results of its first phase open-label study to evaluate the safety and exploratory efficacy of its PLX-R18 treatment, the 18 standing for Chai, for life, right?
Exactly.
In humans with HCT. So for our non-medical listeners, tell us what HCT is, and why is this such a major achievement?
So this is another good example for patients that are in a very severe condition. These are oncology patients that as a last resort went for a bone marrow transplantation, which is quite an acute and quite a dramatic situation for patients. We are using our product for these patients that did a transplant but didn't engraft well. So they still have a very low blood counts, and these patients are actually candidate for a second transplant. The only thing that about 80% of the patients that we're going to go for a second transplant will die. So we developed this product together with the NIH in the US and the Department of Defense for another project that they have in radiation countermeasurement. And based on this data, we actually started this study treating oncology patients, helping them to avoid the second transplant. And yes, we announce a very good data showing the ability of the cells to support the recovery. And I think that offers a great help for many patients, oncology or hematology patients that need a product like the PLX-R18, and that's going to stay for high.
Amazing. Now, what are the next steps for that project? You know, when do you see that going to a phase 2, phase 3, and maybe even making it to help people?
So we are pushing it forward for at least one indication that's going to go for a phase 2. We intend to apply with the US FDA this year, obviously with Israel. We had some interesting visits here for looking for potentially partnership also in these territories. So it's moving forward for additional clinical studies, and cell therapy is coming and coming big time.
Amazing. Now, as a health reporter, I've been, as I mentioned, following Pluristem for a number of years very closely. And I would say that it has been a really special month, though, for you in the last 30 days, because aside from this great information about the data, you just talked about a 20 million euro investment from EIB, the European Investment Bank. What is that for?
So in Pluristem, we are developing platform. We are developing technology. We are a very technological company. We more 120 patents are granted. We have probably the facility which is the highest capacity in the world, which is based in Israel, in Haifa. And we are developing this platform for cell regeneration. I truly believe that all of us are going to use that as a first-line treatment in the very near future. This is a project that we initiated actually last year, where the European Investment Bank said, we have an interest to look for the next generation therapies. All of us are aging, the world is aging significantly. Europe is quite an extreme case for aging that is coming, and they would like to invest in therapies that will enable all of us to treat our elderly and patients in a reasonable way. So they provided with a 50 million euro facility to develop our platform. We just announced this week or last week that we met the first milestone, and that injected the 20 million euros into Pluristem, and yet to go.
Unbelievable. Now, mention a few of the other indications that these PLXR18 cells work for, because you mentioned radiation, and I know there are many others, so let's talk about those.
Yeah. So the PLXR18 are also placenta-derived cells. We are investigating this product in the last 5 years, mainly with the NIH, National Institute of Health in the US. And about 2 years ago, the Department of Defense also participated in this program. We were able to show that if we inject the cells to population that is exposed to very high level of radiation, like nuclear radiation, we were able to increase survival from 30% to close to 100%. And we're talking about post-exposure to radiation. We get a lot of interest from this project. Fukushima in Japan are also partnering with us. And this is something that we are developing. The cells have quite a broad applications, and today, since we have such a strong platform, we can utilize different cells for targeted indications.
Unbelievable. And with something like the radiation, these are off the shelf, if I remember, so you can go out into the field and inject them right then and there if, God forbid, there's a reason to do it.
It is as simple as you can think. We invested heavily into it, but eventually it looks like that, cells in a vial. So the doctor eventually get vial with 100 million placenta cells. You just need to take them out and inject. As simple as that. And it's like iPhones. There should be a lot of technology behind it, so it's going to be a simple use for the user.
I'm not sure everybody thinks iPhones are that easy to use, but anyway. Now, you've already had some collaborations here in the United Arab Emirates. That's correct?
Yep.
So tell us a little bit about the collaborations that you have, and also, what are you looking forward to in the next several years in the UAE?
So we feel very privileged to be one of the first companies that signed an agreement after the Abraham Accord last year. We did enter into collaboration with the Abu Dhabi Stem Cell Center, which we visited the guys last week. And we do find on the other side very strong, very clever, very strategic partners that wants to understand that cell therapy is coming and coming big time. Today we have with them a clinical research or clinical agreement. And we are visiting this region, and I think we're going to be here more and more because we see the level of interest from many parties. And I'm very impressed with the strategic thinking, investments, long-term thinking, because eventually all of us need that as human beings. We're going to intend to push it forward. We're going to focus some efforts for this region in the coming month. And I want to see these PLX products and other collaborations between the two nations to support the well-being of both countries, economically and from the healthcare system. And as I said, I feel privileged to be part of this amazing journey.
Amazing. Well, thank you so much for being here today, and I hope that we will hear more about the next generation.
Thank you very much.
Thank you.
Thank you.
So now I have the privilege of calling up Dr. Tatiana Zelenova, who has more than 25 years of experience in the medical practice, including 20 years in the field of cardiology. But wait, what makes Tatiana unique, she comes on up, is that she's not just treating patients. She has successful experience in creating medical centers from scratch and working across borders to ensure that people get the health care they need. Tatiana, thanks for being here.
Thank you, Maayan. Thank you, everybody. I'm really excited to be here and to be surrounded so amazing people. I'm really proud because, we have clear understand what's happening now. And just some few words about myself. I'm medical doctor, I'm cardiologist, and I headed last year's Hadassah Hospital branch in Moscow. It was the first international branch in Moscow. I have great experience in R&D, launched clinical trials units and centers, launched from zero, from scratch, hospitals and international department and university. That's why I have a huge amount of friends all over the world and high expertise medical doctors, professors, etc. So we have to understand that we live now in dramatically changed worlds, and we have to understand we live in perhaps not in crisis time, but recession. And my opinion, just two direction, medicine and IT technology can break through instruments, tools. Even imagine my experience 25 years from student with phonendoscope, and now imagine as a medical director, as a manager, I have in my hands tools, telemedicine. Last year, imagine numbers increase 4,000%.
The use of telemedicine, amazing, 4,000%.
American Investigator Center shows 4,000%, 1 million consultation only in USA. Telemedicine, medical information system, artificial intelligence because of big data, teleradiology, teleophthalmology, artificial organs, 3D prints. My colleague Yaky, thank you very much. Very interesting interview because I believe in stem cell therapy. I have already patients who are on such therapy in different phases, and really very interesting time.
So let me ask you this.
Yeah.
You talk about telemedicine, which really means that you don't have to go and physically see the doctor to get the care that you need. So you are doing something that you call medical care without borders. Explain what that really means. What is healthcare without borders?
Medicine for me all the time, and for our company Health Plus, I present here Health Plus company, and our mission is the international marketing arm of Hadassah. Our mission is medicine without board, because it's not only my opinion. For medical doctors, staffs, nurses, medical professors, it's not important for us the nationality, races. It's not important where I am. I like to say it's very important who you are and what are you doing and with whom you are doing. That's why for me it's medicine just a challenge, especially now new words, digital medicine appear, digital healthcare.
Amazing. Now, since the signing of the Abraham Accords, you've been working very hard to sign deals and collaborations between different hospitals in order to allow medicine without borders to take place between different borders, between, for example, the UAE and Israel. There was one hospital I know that you spearheaded with. We talked about Zaleka and Hadassah, but there are others since then. Tell me what you're doing in terms of collaborations across the border between Israel and here.
Thank you very much. Good question, because, you know, since March we have already made and CEO of company, David Berezin. David, thank you very much. When I arrived here first time in my life in December, I thought, my God, they opened the board. It's really a challenge for us. And I met a lot of colleagues, the key opinion leader here, visited hospitals in Abu Dhabi, Cleveland Hospital, Burjeel Hospital, Health Point, Mediclinic here. They are very different. It's really interesting. There are the best building, medical technological construction building here. One of the best equipments and instruments, medical equipments. But I think this is not problem of UAE. This is the great challenge all over the world, the lack of staffs, the lack of medical doctors, the lack of nurses, educationable, competence persons. That's why we very quickly changed our business model, and first of all, because the company has great experience like a facilitator, medical tourism, and we decided to bring here and organize the Center of Excellences, the Center of High Expertise, and to organize telehealth center, command control center, and to bring here medical doctors who provide treatment, surgery, provide education programs, R&D, etc.
Amazing. And as you mentioned, it's bringing new technologies, biotech, higher standards to the area. Why is this so important?
It's very important, biotech, very important technology. But I want to notice that's more important, and reporters has already told human capital. Human capital, that's why we have like an association of Israel-based expertise, key opinion leader, European, and we will bring them here. That's why we organize platforms on medical universities and hospitals.
So it's more about bringing the people who can provide the treatments to the places.
Thank you, Maayan.
So now recently, in Israel, we had a very challenging security escalation. It was not only the one that most people read about in the headlines between Israel and Hamas in Gaza, but it was also on the streets. There was an outpouring of violence that erupted between Jews and Arabs in our mixed neighborhoods that were historically known for coexistence. And, as the fires flared across Israel, what was so fascinating was the doctors and the nurses offered testimony that coexistence is possible, and they called on Israeli society to learn from what happens in the halls of Israeli hospitals. Many people believe that science and healthcare are the foundation for peace in the Middle East. What do you think?
Exactly right. Because, when it's very important, and a lot of speakers have already told that very important to bring here and to organize education. Bring education, because when the people are educatable, they don't need to fight. It's simple, It's
amazing. Well, let's hope that that is a great start to the future of more peace and bringing health and science for that purpose. Thank you so much.
Thank you, Maayan. Thank you, everybody.
Thank you.
Thank you.
So now I have the privilege of calling up Noam Salman, the CEO and co-founder of Immunai, the first and only company to map the entire immune system for better detection, diagnosis, and treatment of disease. Immunai is using single-cell technologies and machine learning to achieve its goals. Thanks.
Thank you.
So we decided to pull out Immunai, as you know, and spotlight the company when we really learned about its incredible growth in the last year, when everything else with COVID-19 in our economies was shrinking. I understand your company tripled in size in the last year, expanded to new locations. Explain exactly what Immunai does, and tell us, why do you think it's working?
Thanks, Maayan. So before I start, I also wanted to thank the organizers for inviting me and to speak with such a great and distinguished speakers. There is a nice saying that you shouldn't let a good crisis go to waste. And this has been a colossal crisis all over the world, but there is one takeaway that Immunai has leveraged even before the pandemic. Like our name, we are mapping the immune system. And I think that the entire world understood that the immune system is critically important if we want to improve health and find new drugs. So this was the main driving force behind Immunai, and indeed we tripled in size. We raised a handsome financing round even during the pandemic, and we are expanding partnerships all over the world.
Amazing. Now, Noam, you and I have spoken before, and you've mentioned to me that Immunai is fully mapping the immune system, as you just said, but that you equated it to a Google map or to Waze. But the main surprise is that most of the roads, as you call them, in the human immune system have not yet been paved, and over 90% of diseases have no path back to health. Can you explain what you're doing that's going to change this notion? How are you going to find new drugs, new treatments from what you're doing?
Definitely. So in Immunai and in other biotech companies, we are literally standing on the shoulders of giants. And I'll go back in history and say that one of the biggest achievements humanity had especially in the space of biology, was that we fully mapped the genome. So the Human Genome Project that was completed on the change or the turn of millennia was a monumental achievement, and there was a belief in the world that this is going to maybe end disease. This is not the case, but we keep making progress. And the past 5 and 10 years in medicine and biology were transformative. What we are doing in Immunai, like you mentioned, Google Maps or Waze, we have generated tens of millions of immune cells from thousands and thousands of patients in different states of disease and health. And like in Waze or Google Maps, we put them all in one map. And with the power of big data and AI, and mining with artificial intelligence and machine learning, we were able to identify mechanistically what is the reason for why certain patients respond to therapy and others do not respond. And like you said, more than 90% of diseases do not have a therapy, so we took upon ourselves to develop the next generation of therapies that are immune-mediated.
Incredible. But medicine in general, I mean, it's not an exact science. Are you thinking that it might be able to become one?
Yeah, I'm a mathematician by education and training, and in fact, we founded the company when I was working as a researcher at MIT. And I heard from many clinicians and medical doctors that medicine is not an exact science. But this is the era of precision medicine. And Immunai, along with other companies, is help bringing this next generation of medicine, which is an exact science and is relying heavily on big data of biology and clinicians.
Incredible. Now we're here at the Global Investment Forum, and that's in the United Arab Emirates. Do you have any Emirati investors, for example, or are you hoping to get some?
We actually have Emirati investors that invested in some of the VCs that invested at Immunai, and I even happened to have met one of the main investors yesterday. I will say something that, first, as an Israeli, it's a great time to live. We lived, growing up, I grew up in Tel Aviv with a peace agreement with Jordan, and for many years, more than 20 years, we've been waiting for the next thing to happen, and these are exciting times with the Abrahamic peace accords. We are hoping that the Arab world and Israel are going to work unitedly, and I think that already now with partnerships between hospitals in UAE and with hospitals in Israel and in other places, things are beginning to move in the right direction, so it's very exciting.
Wonderful. Well, I hope that when we check back maybe next year, we'll hear about 6 times more growth, and we'll know about more investors from the UAE in Immunai, and hopefully some the other way around. Thanks so much.
Thank you very much, Maayan.